Hello class, this is Audrey Torres. I will be presenting Intersectional Mainstreaming and Sightsavers Lady Health Workers Program in Pakistan. The author of this article is Dr. Clara Fischer. Dr. Clara Fischer is involved in the areas of social and political theory, feminist theory, and gender politics. She is a Vice Chancellor Illuminate Fellow at the School of History, Anthropology, Philosophy, and Politics at Queen's University, Belfast. Previously, she worked at the Centre for Gender, Feminisms, and Sexualities at University College Dublin. Her research interests include feminist pragmatism, theories of emotional affect, embodiment and shame, institutionalization and containment, gender and austerity, women and the politics of crisis, Irish feminisms, and gender and nationalism. Dr. Fischer is involved in civil society research and advocacy, having worked in the Irish Parliament and NGO sector. She is a freelance consultant on gender and equality issues, a founder of the Equality Budgeting Campaign, a former director of the Irish Feminist Network, and communications officer of the Society for Women in Philosophy Ireland. In February of 2017, she formed part of the Irish Civil Society delegation to Geneva, representing Ireland in the examination of women's human rights at the UN. She received grants and fellowships from the British Academy, the European Commission, the Society for Applied Philosophy, the Community Foundation of Ireland, and many more. In 2018, she was nominated for a Teaching and Learning Award in the UCD College of Social Sciences and Law. In 2017, she was awarded for public philosophy on issues of gender, sexual orientation, and feminism by the Society for Advancement of American Philosophy. You can find more information on Dr. Clara Fischer, including her academic work, media, and advocacy at clarafischer.com. For the main points. The rhetoric of gender mainstreaming has been gaining recognition since the early 1990s. Many development agencies have committed themselves to gender equality in the organizing and implementing of their programs. Because of this, the area of gender issues has ample material, more than 2 decades worth, for assessment and critique. Gender equality has been carefully applied to training, gender proofing of documents, designing gender-sensitive monitoring and evaluation systems, instituting women and minority-friendly human resources, and the inclusion of gender analysis in program planning and impact assessment. This all has provided insights to the successes, but also the areas in need of critical inquiry and of maintaining mainstreaming as a strategy. Questions, arguments, and general excuses against intersectionality include, but are not limited to, the topic of limited resources. Should one type of mainstreaming be prioritized over another? Should mainstreaming of certain areas be put on hold until adequate financial resources are found? Should certain issues take precedence depending on the context? For example, gender issues in political participation programs, or sensitivity to disability in healthcare programs. The last question actually refutes the central tenet of mainstreaming, but it still comes up and therefore has to be listed. The lessons learned in this process of gender mainstreaming will be juxtaposed with competing claims to mainstreaming from cross-cutting aspects of development, such as disability, age, HIV, etc., that appear to demand similar programming and organizational change. Dr. Fischer draws upon the work of Sightsavers, an organization set up under the larger umbrella of Vision 2020, which seeks to eliminate avoidable blindness by the year 2020. Sightsavers has programs in over 30 countries, but for this particular article, we will be focusing on its Lady Health Workers program in Pakistan. Sightsavers was developed with the purpose of empowering visually impaired and blind people. Many organizations are only beginning to consider the value of mainstreaming disability into their work, whereas Sightsavers has built its whole policy and programmatic responses around an expertise in disability and impairment. Disability mainstreaming is in the same need for attention and incorporation that gender was 20 years ago. Established in 1950, Sightsavers is the perfect organization to share its knowledge and experiences with other development agencies in mainstreaming disability. That being said, Sightsavers could also benefit from learning of mainstreaming gender from these other organizations. It has only just recently begun to address the need for integration of gender in all aspects of its work. Sightsavers' Lady Health Workers program was able to identify an obstacle in women's inability to seek more regular treatment. Checkups from a male doctor without the presence of a male relative was a significant factor in the decreased uptake of eye care in Pakistan. So the program expanded its expertise by partnering up with system of women's health workers to include eye care. Lady health workers in Pakistan delivered primary health care to their communities, and now the program enables them to also administer eye tests. This facilitates services for women as the gendered norms regulating female-male medical visitations currently are. Importantly, an awareness of the libertary goals, concepts, and strategies as they originated in the social movements that first coined them is of the utmost importance. The referenced shortcomings was the mistakes seen in the transition from the women in development approach to the gender and development approach. When the focus of the suppression of women in the development process shifted to a perspective that included men's roles in creating and perpetuating injustice, it took attention away from speaking explicitly about women in some situations. This was an equity problem. Power imbalances between women and men are thereby obscured, and mainstreaming becomes incapable of tackling inequalities and instituting change. For critical analysis, Fischer suggests broadening the current practice of intersectionality to include other cross-cutting aspects of development, such as disability and age. Gender mainstreaming basically monopolized the conversation and derailed a holistic intersectional mainstreaming agenda. The work of Sightsavers' Lady Health Workers program in Pakistan not only focused on disability, but also contextualized inequality and gender barriers to healthcare. The program goes beyond information and visual impairment trends and treatments. It speaks to the complexity of the human experience. Women's lives are defined not only by their gender identity, but by how this is influenced, and in turn influences their experience of race, class, age, and other categories of difference. With this information, development agencies' attention is drawn to the inner functioning oppression that results from separating gender and disability, so better support can be addressed. This contributes to mainstreaming by going beyond gender mainstreaming and into a more broad coverage of intersectional mainstreaming. Exploration of mainstreaming, in addition to intersectionality, is also very important because it can allow for more specific situational analysis to be looked at. Policies and interventions can then center themselves on this interrelatedness. Intersectionality mainstreaming can challenge the status quo by empowering those who are traditionally excluded. The pros that I found for this article: first, it effectively addressed intersectionality. Second of all, the case study used was an appropriate example of intersectionality mainstreaming. And third of all, it addressed arguments in opposition to the main point. She provided examples on how arguments could counter the arguments for mainstreaming intersectionality. For the cons, I saw a missed opportunity to address the plan for effective practice that addresses personal bias within organizations. Second of all, she could have brought in voices of people being helped by the development programs. So the people that it was aimed to help could have provided some more of the answers that these organizations are looking for. Unfortunately, that wasn't included. She referenced a lot of experts as professionals and scholars, but I think that the voice of the experts are the individuals with the intersectional complex identities that need to be helped. Some questions to consider. What are some areas of a complex identity that haven't quite broken into mainstreaming circle? Second, how can society, at every complexity, make a difference in pushing for more intersectional mainstreaming? Third, can you think of a personal experience with a development project where the inclusion of more diverse information could have made a difference? Lastly, Vision 2020 sought to eliminate avoidable blindness by the year 2020. Where are they now in 2022? Please let me know if you have any comments, questions, or concerns of your own. Thank you so much for your attention.